asked for a work requirement as part of the state's application for a federal waiver to be renewed to allow HIP 2.0 to continue. And in this guidance from the Centers for Medicare and Medicaid Services today, the federal government is pledging to back states like Indiana that want to make work or community involvement a stipulation for eligibility. The condition would apply to about 1/3 of the able-bodied adults who are enrolled. That doesn't include the elderly or pregnant women. The state wants to require those adults to work 20 hours per week, be enrolled in school at least part-time, or participate in the state's Gateway to Work initiative that connects them with job training and employment services. In a statement, Family and Social Services Administration Secretary Dr. Jennifer Walthall says her agency is pleased to receive the guidance that supports the state's plan. She writes, becoming an active and productive member of the community is an important part of healthy living. We'll work closely with eligible HIP members to find the best options that will, over time, help them lead to self-sufficiency and stability, as well as employer-sponsored or private market health coverage. The Indiana Institute for Working Families opposes the condition.
What we find mostly in the field is that people who can work are working. And so what we're left with are folks that may have some vulnerability, they may have some barriers to the workplace, and what would be a more effective strategy would be to identify those barriers and put some things in place that can help.
The FSSA secretary expects the state's application for renewal to be approved in the next couple of days. At the State House, Katie Hines, RTV6.